Tonight we're putting a small but very special group of cancer patients in focus. The 7% who are under 40. Tonight at 11, you're going to meet a young woman who discovered a suspicious breast lump and became one of the nearly 13,000 women under the age of 40 to face that breast cancer diagnosis. Head of her story, we're talking to her physician, Dr. Suman Rao, director of the Thoracic Medical Oncology Unit at MedStar Franklin Square Medical Center and the MedStar campus in Bel Air. Thank you so much, doctor, for coming in.
Thank you for having me, Kelly.
Jamie, an amazing young lady. We got a story tonight at 11 o'clock, but let's talk about the age group. Jamie was 36 when this happened.
Yes.
Should people under the age of 40 have mammograms?
Not on a routine basis. If you have a very strong family history, if you have a reason to worry about breast cancer at that age, then yes. But certainly if you have a lump, if you have something that concerns you, I think you should get a mammogram. Sometimes what happens is that when you're younger and you're concerned, a lot of the time your physician even sometimes feels, oh, this may not be breast cancer, you're too young to get breast cancer. It is important to advocate for your own health. In general, women under 40 do not need mammograms regularly, but if you have a strong family history, if you have a mutation that you know of in the BRCA gene, then it's very important to get mammograms.
Now, breast cancer, is the treatment for women under 40 different? I know she's doing some infusion type treatment to keep it from recurring, but traditionally?
So breast cancer is a little different in younger women. Firstly, because it is not diagnosed early, because of the fact that you don't get mammograms on a regular basis. Breast tissue can be pretty dense, and so that can sometimes cause problems with diagnosis. And so often it's diagnosed at a little bit later stage. But also breast cancer in younger women tends to be a little bit more aggressive, a little more fast-growing, and sometimes less responsive to hormone therapy. And sometimes the treatments are a little bit different. The hormone therapies we use, the pills we use to prevent breast cancer recurrence are different in younger women than in patients who are postmenopausal. With Jamie, what we're doing is we're using an infusion, an injection, actually to prevent her from having ovarian function.
It's like an early menopause, you said.
Kind of. We're putting her through a temporary menopause, if that's what it takes to keep her breast cancer from coming back. So this study was done recently looking at the addition of causing menopause to the regular hormone therapy, and it really seems to add benefit. So we're putting her ovaries temporarily at rest, so to speak, to keep this cancer from coming back.
All right. Dr. Rao, thank you so much for coming in.